Warning, this content may be upsetting or disturbing to some audiences. What is the most disturbing thing about childbirth that non-parents might not realize? I'm 20 years old and just recently gave birth to my baby girl. Childbirth was horrific. I had to be induced at 37 weeks because of gestational hypertension and severe edema. Most people don't realize that when you're induced sometimes it can take over 72 hours until you deliver. I was at my breaking point. I was already 3 centimeters dilated on my own naturally when I went into the hospital. Luckily, I was dilated enough that I didn't need a balloon shoved up there to self-dilate. All they would do for me is push pitocin through an IV at that point and see where it went. Well, it was going nowhere. I wasn't dilating enough as I was at a 4 and I was stuck in a hospital bed and haven't eaten in over 32 hours. I was livid. At this point they were talking about breaking my water. But there are so many risks associated with someone breaking your water, so I tried so hard to hold out. Unfortunately, I had to have my water broke. I decided to get the epidural when I was at a 4 just in case the labor progressed fastly and I had no options of pain management. Then, less than 2 hours later I was dilated to an 8. But the only reason everybody realized this was because I was screaming in immense pain. Obviously, this shouldn't be happening if I had an epidural. The epidural only worked on one side of my body. It was the most frustrating thing to be practically paralyzed on one side of your body than the other side in excruciating pain. All I remember at that point was a team of doctors and nurses storming in and trying to position me the best way to redo the epidural. A little less than an hour I was dilated to a 10. I was now ready to push. My baby's father held one of my legs up and in just 3 pushes she came out. The worst part was the fact my tissue had no time to prepare itself to stretch because of how fast the labor progressed at the end, so I tore on both sides and needed stitches. The after part of birth probably was the worst for me. After driving home with my mom I remember collapsing upon coming inside. My feet and legs were now the size of balloons, so much so that I couldn't walk and fell down on the floor. We were so scared about blood clots and losing complete circulation. My mom called 911. The first hospital I went to basically checked for blood clots, but I didn't have any, so just told me to go home. And that I was fine, it was just the saline and fluids they push during labor for that extent of hours that caused this much swelling, as I already had bad edema. Then if that wasn't traumatizing enough being in the hospital again right after giving birth, the next day I had to legally bring my newborn daughter to a doctor's appointment at 11 a.m. I did everything I could to pull myself together after dealing with a crying baby all night. But I was so nauseous and couldn't even walk, on top of being in so much pain in my vagina that I had to hold onto the wall. My feet were so swollen I had to wear slippers as none of my shoes fit. I showed up to the pediatrician visit, and after a couple minutes of being there the doctor called 911 and I was then again rushed to another hospital because of how severe my symptoms were. After some testing I had a UTI and was severely dehydrated. I was placed on antibiotics, pain pills, and stool softeners. Thank God I had my mom to help me care for Mila because I literally couldn't get out of bed. For a while it was hard to pee, move, or do anything. My back still feels pain from the epidural to this day. It felt like I was being stabbed by shards of metal with the stitches intact. The UTI was also debilitating, on top of heavy bleeding and leaky breasts. Then if this all wasn't enough, here came the postpartum depression. I found myself not eating, not leaving my room, not being able to care for my daughter. It was like I hated her. I remember telling my mom, please just give her to a family who wants her. I can't care for myself and I can't care for her. I couldn't even hold her. I cried all the time. I couldn't shower, I couldn't even function. I don't think people take into consideration the labor process, healing, postpartum depression, sleep deprivation, etc. As if pregnancy wasn't hard enough. That after your child is born, you've passed the placenta and all initial weighing, testing, etc. is completed, you're basically left to fend for yourself and care for a newborn after having just completed what is probably the most physically strenuous task of your life. I mean, sure, there's blood, there's goo, there's damage to your ability to control when you pee, there are various pains, and, if you're anything like me, you'll likely lose any sense of modesty, as in the moment you just need to get through the contractions however you can. You might have something more serious happen. But honestly, if things go well, all of that is a passing experience that the human brain does a nice job of helping you gloss over after the fact. The thing that really was, if not disturbing then certainly the most difficult for me, was sort of feeling like a discarded, used up piece of meat after the fact. I had been up all night, was exhausted, was shivering from exhaustion and the hormonal changes. In fact, I was connected to an IV drip and blood pressure monitor, basically forcing me to stay in bed, and then everyone left the room, leaving me, my husband, and this tiny sleepy baby. Lots of first-time mothers experience enormous amounts of anxiety, often to clinical levels. It is easy to see why. You spend a lot of time preparing for labor, but once it is over you're faced with a whole new set of challenges, all while trying to recover your own body and, hopefully, maybe get some rest. I would say the lack of support and extreme shift of focus from the well-being of the mother to the child in those moments definitely counts as disturbing. I hope for anyone reading this about to go through this that you have a lovely, wonderful support network. Everybody is mentioning all the icky stuff and the bad hospital treatment, but how about this? The most disturbing thing for me was not having that immediate maternal, overwhelming feeling of love for the child I had carried for 9.5 months and then birthed. Everyone tells you you immediately love your baby. Well, I did not love him, but I was more in love with having that alien removed from my body. I had a C-section, so possibly it was all the drugs. Once he was pulled out, I waited for that cry that says he's breathing and I guess he's okay. They cleaned him up and my mom filmed that part. And once he was decent they said okay, put him by mom's head so she can see him and take a picture. I watch this now and immediately start bawling. I've seen that picture and I had the most non-genuine smile I've ever seen of myself. He was then whisked away while my parts were being shoved back in and I was being sewn up or stapled in this case. Got back to my room and there's this baby who lived in my body all this time, suddenly out and in a crib thing. And he was funny looking, and not that cute. I was soon forced to start breastfeeding, despite my drugged, out-of-body feeling. And when I held him for the first time, all I could say was okay, hi baby. There was no rush of love and happiness, only slight awe I guess? Because I got to see what was causing me so much pain for months. And that pain was gone, but I just stared at him like, what is this? Maybe it was the drugs. After a day or maybe even few hours I couldn't bear to let that little human out of my sight. But my point is, I was waiting for that overwhelming rush of love and hormones and it didn't happen for a while. Maybe like a week before I'd fight a person that tried to take him away or tell me I had to put him down because the mother also has to sleep at some point. He's 18 months old now, sleeping in his own bed all night, and I still have to fight the urge to go get him and put him in my bed so I can be close to my baby. That it hurts, and bad. One thing movies and reality TV leave out is, once at the hospital, you can't just request an epidural, and the person comes from behind a curtain with a needle ready to stick you. That is farthest from the truth. First, they have to make sure the person is even there. Once confirmed, there's things that needs to be done before they can even relieve you of the pain. An IV is a must and lab work is a must? Yes. Lab work is a friggin' must. God forbid, you get to the hospital at 9 centimeters dilated because the labor and delivery nurse you spoke to on the phone tells you that you're probably not dilated that far. If you can speak through contractions, it's not time. So when you go try to have a bowel movement and your bag is coming out, which you've assumed to be a friggin' elbow, you think to yourself that nurse is full of it. Sorry, I got off track, forgive me. So the nurses inform you, they have to take some blood and send it to the lab before they can relieve you of this pain. But in the meantime we want to ask you random questions that involve your occupation or the subject you're studying in school. Oh nice, it's a speed date. At some point, your lab work will be complete, and you ask the question your soul has been dying to know. Is it too late? Will I even be able to get the epidural? Once you get the epidural or spinal, it's smooth sailing from there. God bless anyone who has done this naturally. Well, there it is. I hope you enjoyed the first video of this channel, and I hope I didn't scare anyone from the prospect of childbirth. You are amazing. Subscribe to my channel for more stories outside of Reddit.